Good afternoon, everyone. I welcome you and thank you for joining the Florida Food Policy Council's monthly Florida Food Forum, the only regularly scheduled food forum in the state. The event is hosted by the Policy Committee of the Florida Food Policy Council. I am Del Deschamps, the co-chair of the committee, and Jennifer Parker serves as the other co-chair. And I don't know if Jennifer is on the line or not, but I hope she is. And if not, we certainly know that she'll be picking up this recording. With us from the council is the council's administrative assistant, Kendra Love. Kendra will be handling the technical and managerial aspects of our meeting. And I am so appreciative of her, as we all are, for taking leadership in this important area. I'm also asking Kendra to let us all know when session will close and give us an alert when we have about 5 minutes remaining. We don't want to cut off any questioners that are in the midst of framing their question or in our guest's response, but for the purposes of staying on schedule and wrapping up, she will give us a notice around 5 minutes. And Kendra, I want to share the opportunity with you now to present any other additional details that our listeners and participants know about.
The main thing is after the presentation, we will have a short time for discussion and questions. So until then, I've muted everyone. So during the discussion time, if you would like to ask a question, you just need to push star and 6 to unmute yourselves.
Okay, great, Kendra, and thank you again for your excellent technical expertise on this and your generous and friendly way. For now, this month's topic is food policy for wellness. And if you are not already familiar with the relationship of health and wellness to food, today promises to be an excellent introduction. Even more important for the Florida Food Policy Council is the relationship of food policy to issues in food and wellness. If you're already informed on this topic, that is terrific, and we certainly welcome your input as well. And our session should expand and deepen your understanding as well as our collective understanding as well. So thanks as always for joining us, and be sure to mark your calendars for our monthly Florida Food Forum, the only one of its kind in the state. We always have exciting and dynamic presenters and excellent topics. So I do want to take just a moment to extend holiday greetings to everyone tuning in or calling in today. Today we're on the cusp of a cavalcade of holidays, religious and secular. Coming up in sequence, we have the winter solstice, followed by Hanukkah, then Christmas Eve, Christmas Day, Kwanzaa, New Year's Eve, and New Year's Day. So if you celebrate any or all of those holidays, happy holidays to everyone, each and all from the Florida Food Policy Council. A document introducing our topic for today is posted on the Council's blog site, and if you registered for the event, you have seen the document. Today, we welcome Dave Krepcho to leadership of this month's forum. Dave is president and CEO of Second Harvest Food Bank of Central Florida. With 26 years experience in food banking, and especially with service and professional engagement with Feeding America in national and regional leadership positions. You can find much more information about Dave's background on the Florida Food Policy Council blog for today's event. Following Dave's presentation will be an opportunity for question and answer on the topic. And before going forward, let me invite everyone here today to consider joining the Florida Food Policy Council. You'll find information about membership on our website. And now as I turn things over to Dave, I'm asking that he tell us a little bit about himself and what inspired him to take leadership in this important area of our food system and our culture as a whole. And so with pleasure, we welcome Dave Krepcho. Dave?
All right. Well, thank you for the opportunity to spend some time with the council and present some of our work. Really do appreciate that opportunity and spreading the word. One of the reasons why I got involved in this kind of work, it's really coming from a social justice issue. There's just such inequity in society. That's very, very top of mind now politically, that's talked about. And this polarization of society is just becoming greater and greater, the gap of wealth and people who don't have wealth. But many, many years ago, it's just really from a social justice issue that something, how can we more level the playing field between the haves and the have-nots? I grew up in a working class blue collar family, one of 5 children. My dad worked in a steel factory. And there was a short period of time where his union went on a strike and we didn't have food for a while. So, it hit close to home. That's stuck with me. And food is just such a basic building block. It's at the core and the foundation of Maslow's hierarchy. So those are the kinds of things that really inspire me and attract me. And then working with a community that gets aligned with you is just incredibly energizing. So I will start with my PowerPoint here. I want to move through fairly quickly because it is posted on your blog site. And I want to allow for some time for questions and answers. So I'm going to move fairly quickly. So I guess save your questions for the end of the presentation. So a heads up on that. So today, the key ideas that I want to share are 3 major ones. The intersection of food insecurity and health. The second is our Central Florida response to it. So talk about non-traditional partnerships and the Health and Hunger Task Force. And then thirdly, a little bit about our local pilots and projects and next steps, where we're going. So with that, I want to give you a quick background. This is not going to be a PowerPoint on Second Harvest in totality, but our mission is to create hope and nourish lives through a powerful hunger relief network while multiplying the generosity of a caring community. Some of the key words in there are right in the middle: powerful hunger relief network. And what that means, the big part of that network, we provide food to 600 different charitable feeding programs in a 6-county area of Central Florida. So we cover Orange, Osceola, Seminole, Brevard, Volusia, and Lake counties. And that's a wide variety of food pantries, homeless shelters, soup kitchens, homes for abused women and children, as well as schools and hospitals and clinics. So we have broad reach, and those partners are reaching a collective of close to 500,000 different people each year, about 14% of our population there. So that's a large chunk, large responsibility. I wanted to show this chart to give just a sense of our size and scope. We don't cover from Orlando to Los Angeles, as the map shows, but we distributed last year in our 6-county area enough food for 60 million meals. If you lined up dinner plates, place settings next to each other, end to end, it would stretch from Orlando to LA back and forth 4 times. So try to wrap your head around that. But with that, with such a large network and access to surplus food that is healthy, it dawned on us we could possibly have an impact on healthcare if that food was, definitely nutritious, and if we were able to bring along nutritional education with it. And with that, it really started our talks here with our senior team and board about, different kind of strategy for the food bank. So Central Florida insecurity, almost 14%. I mentioned, about 500,000 Central Floridians. 180,000 are children, which is just not right. And we've been able to measure a meal gap in our Central Florida area. And as you could see by the number there, 110 million meal gap. That's despite what we bring to the table, a second harvest, what SNAP brings to it, school lunch, school breakfast, summer feeding, WIC, and some other organizations. So we are far from closing the gap. So Florida has the third highest number of food insecure children in the country, something that we are definitely not proud of. Of the households that are served by our network, 3/4 of them they live in poverty, okay? The remaining 26% are 130, 180%, 200% of poverty. And unfortunately, that number is actually growing in this healthy economy. Half of them exhaust their SNAP benefits in 2 weeks. 60% of them were employed households last year. So they're trying to make ends meet, and that means trade-offs and really tough decisions. As you can see here, 70% had to choose between paying for utilities and food, another 67% between transportation and food, and another close stat, 66, had to choose between paying for medical care and food. 57% had to be between paying for housing and food. And as we know, these are a lot of the root causes, a few root causes of hunger is just a symptom. We have an lack of affordable housing crisis in the state and across the country. And healthcare is a real huge issue in our country. And public transportation in Central Florida and most of Florida is severely inadequate. So food insecurity ultimately leads to poor health. And in this central chevron, that gets into dietary intake, the amount of food, the kinds of food. Stress plays a huge part. The population we're serving, they're not in a thrive mode, they're in a survival mode. Self-efficacy, that's about taking care of yourself, making good decisions around food. Bandwidth, again, that's an environmental kind of thing. You think of a single mother, she's got to get to her 1 or 2 jobs, she's got to catch a bus, she's got to get the kids to school, feed them, all those kind of issues, which leads, directly into competing demands on time and budget. And then binge fast cycles. At times they may have some access to food, but it may become a binging kind of exercise, and then they're left short to fast. Employability is a huge one, and stability. So all those factors are having an impact on poor health. This cycle here, I think is really, really important to frame the cycle of food insecurity and chronic disease. So if you start at 12 o'clock in the food insecurity block, move to 1 o'clock, there's got to be some health promotion there, but go to 3 o'clock and you have these coping strategies as a result of food insecurity. And I mentioned those briefly: dietary quality, eating behaviors, bandwidth. And then go to 5 o'clock, that often leads to chronic disease. And then you get into healthcare as the intervention at that part of the cycle. When it gets to a chronic disease point of view, we're talking about hypertension, diabetes, obesity. And then go to 7 o'clock, that cycle then increases healthcare expenditures for the household. And at the same time, it will decrease employability. I mean, missing work and missing that income. And go to 9 or 10 o'clock there, household income continues to decline. And then the spending trade-offs that I talked about increase because of the economic pressure due to the health-related. And then you go back to 12 o'clock, and it's this It's this vicious cycle that exists. So this really helped us paint a picture for ourselves and frame on where do we come into that picture to intervene. And at the 1 o'clock area, the health promotion piece, we have implanted ourselves there as well. So on to the next slide. It's a little busy, but again, this was an aha moment. So what are these social determinants of health? And when you look at, there's socioeconomic factors, the physical environment, health behaviors, and last of all, but not least, health care. But if you look at the figure on the left side, the social determinants of health, only 20% of the impact is actually health care through our healthcare system. So it's the vast minority. Health behaviors of smoking and diet or alcohol use, is almost a third. And these socioeconomic factors are the largest category. So that's education, employment status. Do they have a family or social support? Their income and community safety. Just for exercise, some of the neighborhoods, parents don't want to let their kids play outside because it's not safe. But half of these socioeconomic factors can be traced back to your zip code on where you grew up. So food insecurity directly impacts disease risk. So they have increased risk for chronic disease, cardiovascular, hypertension, diabetes, kidney disease, osteoporosis. I mean, there's a significant higher risk in all these areas. Food insecurity directly impacts disease management, okay? So without adequate access to healthy food, management of these chronic diseases is so challenging. So just think about in diabetes, it can lead to increased medication or non-adherence, more food, medicine, medical supplies trade-offs, poor diabetes distress and self-efficacy, and worse glycemic control. So it starts to get rolling down this slippery slope. And also self-management challenges with food insecurity and other diseases. HIV, very, very important on what kind of diets people are on with HIV or various cancers. This is a busy chart. Do not try to read every word or number on it, but I want to illustrate something here. This was an 8 to 10 year study done in California. And it was on admissions attributed to low blood sugar among patients ages 19 and older. So on the far left side of the chart, you will see, the vertical axis. That's the number of admissions, okay, tied to hypoglycemia. And then if you go left to right, the lower two lines of red and orange show all incomes. And then that top right line, the wave that is increasing as you go to left to right, is low income admissions. Almost a third, 27% increase in low blood sugar admissions during the fourth week of the month for the low income group only. Now, when we think about, I mentioned it briefly, SNAP, food stamp benefits typically run out in the second week or maybe the third week. So the decline in food and access to food directly correlates to these hospital admissions. It's not, with all else being equal, there's no coincidence there. From an economic point of view, food insecurity is huge. Here you can see it's almost $53 billion per year in additional healthcare costs. So it's more treatment, more diabetes hospitalizations, readmissions, a high cost user status associated with the food insecurity. And this is one of the major things that got the healthcare industry's attention. Food insecure patients cost the healthcare system, on average, almost $2,000 more per year. I was talking to a hospital administrator a couple of months ago, and he's got a couple of single patients that have cost them $1 million for the year for their health care. People in poverty, and it's dietary related. Here's another way of looking at the economics of it and the value proposition of intervening with healthy foods. And we shared this with the healthcare industry. So, you know, an inpatient admission is almost $18,000 a day. Emergency visit about $1,400. Outpatient is about $400, and they have way too many of these. But weigh that up against about $800 a month for a family of four for food, healthy foods. And the value propositions starts coming into focus very, very clearly. When we proposed a program to a large hospital system here in Central Florida, we presented it not only in terms of better population health, but we actually calculated a return on investment and what would that look like. And after the presentation, we were granted with a multi-year grant and I'll address what we're going to do with that. So population health benefits, but huge economic benefits. So the opportunity, okay, that's the landscape. The opportunity is to work together with healthcare partners as a food bank. 4 or 5 years ago, we weren't thinking too much about that. You could call that a non-traditional partnership. Fast forward to today, and it's a very obvious partnership. So more on that. So one of the things that we started with, we needed to find out much more about their world, and they had to learn about our world as a food bank. And we launched it in late 2015. It took about 1.5 years of very intentional conversations with the industry, getting to know each other better. And the goals in the work groups that we've created, there's 3 key ones here. Food insecurity screening, I'll address that in a couple more slides. Building the value proposition for this work, and really, really key, the bottom line, I think, is measuring health outcomes. It's a platform for funding opportunities. So for any nonprofit, that's always a great interest. Platform for knowledge transmission, platform for advocacy. And we're starting to get into conversations around policy. Pathway to improve patient and community health, and pathway to decreased healthcare costs. So very, very aggressive there, but this Health and Hunger Task Force, the unusual thing is that we as a food bank are convening this, not the healthcare industry. Here's our partners as of today. More people keep coming, but I'm not going to read every name, but we have the 2 major hospital systems at the table at the same time, Orlando Health and Advent Health. I believe Nemours Children's Hospital is going to be coming online. We have the federally qualified health clinics. We have 3 county health departments. We have IFAS from the University of Florida. We have the University of Central Florida College of Medicine, a couple health foundations, and 3 major health insurance companies. We have never worked like this before, but there is so much benefit to this. I mentioned a couple of those on the previous slide, but what's really magical and wonderful is the fact that we are co-creating programs together. In the nonprofit world, a lot that a nonprofit gets an idea or a concept for a program, you create it, you shop it around and try to get some funding for it. So this is very, we believe, is innovative. We're there at the table as a peer. We all bring something to the table. And through this, we've raised at least a little over $1 million in the past few years as a result of this kind of approach. So pilots and projects, okay. The slide's not long enough, okay. And I want to keep advancing in the interest of time. But currently, West Orange Health District, we're wrapping up a 3-year pilot there, a fairly small pilot, but critical, to look at a healthy pantry network, and I'll talk about that in a little bit. Orlando Health, we're doing healthy food boxes with Aetna, the health insurance company. They're providing funding for distribution of healthy food boxes. Grace Medical Home, nonprofit, great partner. We're doing we got a national grant to work with them to do a diabetes prevention program with families. Advent Health, I'm going to talk a bit more about that current program. That's huge. We completed one with the Winter Park Health Foundation, and it says pantry capacity building. This is really critical. You know, if we want to get more fresh foods out to people, the nutritious foods, they have to have the capacity to accept that food and distribute it at their level to people. So, again, over the past 5 years, we've raised over $1 million to help build the capacity of our partner agencies. And that's refrigeration, freezers, refrigeration of all kinds. And then Grace Medical Home with AmeriCares, that's actually the diabetes prevention program. And then under consideration, Aetna Community Care, we're talking to them. Other projects in the Department of Health in Seminole County, there's an on-site pantry for the first time. VA Medical Center, there's a mobile pantry that we provide. I know this is not the most up-to-date list, but that gives you a general sense of kind of the size and the scope and the nature. Some of these are, $10,000 a month projects. Some of them are 3-year, $400,000 projects. So quite a lot of diversity, a lot of insertion points. So this healthy pantry network that I mentioned, what is it? So we have these 600 partners. It's a subset of them. So we go to them, explain what the concept is of a healthy pantry network, and what their part is. If they catch the vision, want to sign on, we sign them on. So we provide them with refrigeration. We provide them with somebody to do nutritional education. And patients, low-income patients that are suffering from a dietary-related disease that are being discharged are referred to this subset. So patients are referred from the pilots. I mentioned the upgraded capacity that we're providing to the agencies, the cooling and freezing equipment, the trained in basic nutrition, and utilizing behavioral nudges. That could be a whole PowerPoint itself. But when an individual comes to the pantry itself, how can you design your pantry and your merchandising and presentation of food to nudge them in the direction of healthy foods? And they become a sustainable community asset. This is like a moral victory for us. And when we first sat down with the healthcare industry, we said, when you're admitting or discharging people, are you asking them if they have food at home? And they looked at us like kind of in silence and go, no, we're not. So there's this 2-question screening tool. It's in the lower right-hand corner in the blue box. Those are the 2 questions. Within the past 12 months, you worried whether food would run out before we got money to buy more. Okay. And then within the past 12 months, the food we bought just didn't last. We didn't have money to get more. So actually, a couple of health clinics are now integrating that in. We're psyched about that. The larger hospital systems have great interest in this, but as I think you can imagine, for them to integrate something like that into these massive systems gets very complex and it takes time. But it's on the radar. They're working towards it. The American Academy of Pediatrics endorsed it. But The second subhead there, responding to positive screens, it's really critical, from the healthcare industry point of view that, okay, so we screen these people, we find out that they don't have food, what do we do with them then? So that's where the food bank comes in and says, here's the system. Challenges, integrating into work. I just talked about that. And then developing recurring data. We want to track the actual health outcomes of these interventions. So what's for second harvest? Sustainability of healthy food costs. That's going to be critical. A lot of the food that we get donated is not necessarily healthy. We're having to see that a lot more. But we have very, very actively gone after more healthy foods the past 7 years. We live in an agricultural state with an abundance of that product, and we're going after more and more of that. I talked to an ag consultant a little while ago, and I said, besides what the Food Bank Network takes, as donations, how much more fresh produce is available each year? He said there's about 900 million pounds of fresh fruit and vegetables that go to waste every year in the state of Florida. So while people are lacking from proper nutrition, we have to figure out a sustainable way financially to access and distribute more of that food. We want to get continued buy-in from the clinical community, the broader clinical community. We obviously want to increase awareness of this whole issue, and not only the issue, but a huge opportunity to start solving it and attacking it. Continued utilization and integration into the healthcare systems. Continue addressing barriers. I talk about this Healthy Pantry Network, and around Advent Health, we're setting them up around 3 of their hospitals here in Central Florida. We're joined at the hip with some of their staff, and when we start getting into their world and their complex world and their large organizations, it's much different culture than the food bank culture. So that we're learning a lot, and also learning about the barriers of the individuals that are in the pilots as well. But that's why you do pilots. We think that there's got to be huge emphasis on nutrition education expansion. You can get people these healthy foods, but often they don't know what to do with them or how to prepare them. One poignant example of that is we were able to get some large donations of brown rice. And as partners were coming in and looking at our inventory, they looked at the rice, and some of them said, "What's wrong with it? It's brown." So they've never seen products, so there's huge need for nutritional ed. And how, also along with that, how do they stretch that SNAP dollar to eat healthier? And then the last bullet on what's next is healthy food access on a larger degree. Food is medicine. Hippocrates said it centuries ago, that let food be thine medicine and let medicine be thine food. And boy, it was true then, and it's true today, and always will be. So we want to get this kind of access and thinking institutionalized across, different provisioners of healthcare. The other thing is, I mentioned it briefly, in these healthy pantry networks, we're going to be tracking actual health outcomes as a result of our intervention. That is substantial. That's like, I think, the holy grail for us. Once we're able to do that, and again, the hospitals are so critical in making this happen. They're doing the measurements on biometrics. It's a condition that they have their biometrics changed checked periodically, because if they want to keep accessing this food and nutritional education, that's a caveat there, a must do. And when we can monetize that healthcare outcome, we believe that can really open up the doors to making this much more economically sustainable. And a clear example of a possibility, okay? But, this is the Food Policy Council members I'm talking to. From a food policy point of view, y'all may know of the Medicaid waiver 1115. And we're talking to Advent Health's chief lobbyist at this point on, once we are able to document with a third-party evaluator and researcher the economic impact of our interventions, we would love to see how this Medicaid waiver might compensate us for our services moving forward. And that will open up opportunities for things like we're already thinking about producing medically tailored meals, tailored to different dietary related diseases. So with that, I did pretty good. We have about 21 minutes for Q&A. I do have one last slide, and I'm sitting here with a secret guest off camera, and that is Karen Broussard. She is our Vice President of Agency Relations and Programs, and her contact information is on the screen. Karen is the point person for all of this work, and she's sitting here just in case I am stumped with a question from the audience. I can only go so deep, but she is hugely responsible for leading our initiatives and leading our relationships with the healthcare industry and building this. So with that, Kendra, I believe you can open it up for people can unmute and open it up for questions or comments.
Wonderful. Thank you so much for the great presentation. Again, if you push the star symbol and then number 6 on your phone, that will unmute you so you're able to ask questions.
I know we had a lot of folks that had communicated directly with me expressing great interest in this topic. So I just want to affirm to everyone, don't be shy. We have a great presentation. We had a great presentation and a tremendous presenter, very knowledgeable. So please offer the questions. We're ready to go on that.
Hello, this is Lisa Pineda from 3 Gems Birth Services in St. Petersburg. Can you hear me?
Hi, Lisa. Yep.
Hi there. Yes, thank you so much for having these. This is really exciting. We are based in St. Petersburg, and we are advocates for Black and infant maternal health. And this seems like something that we'd really like to access. A lot of our young moms do have food insecurity. And even though we are partnered with the Double Up Bucks or the SNAP program to double their food, that's still not sufficient for a pregnant or lactating mom. And I was wondering if you could offer any guidance on that.
Yeah, for sure. And we're looking at a new pilot that's directly aligned with what you're addressing, and I'm going to turn that over to Karen to address.
Hi there.
Can you hear Karen?
Can you hear me?
Maybe come around on camera.
Okay. Hi there.
Sorry, I remuted myself just so my son didn't
Oh,
noise
okay.
in the background.
Can you hear me?
can.
Yeah, so we actually have some interest from one of our hospital partners in developing a pilot. It will be a small pilot to really recruit high-risk pregnant moms who are food insecure into a pilot that will provide a regular access to really healthy nutrition twice a month that will be delivered to them at home by a visiting nurse from the Healthy Start Coalition. I believe every county in the state has a Healthy Start Coalition, and I know ours has this model of a visiting nurse. We will add in the work of a dietitian or a nutritionist at the same time, so that when the food is brought to the home, there's some time spent unpacking the box, talking about the labels, perhaps, providing some recipes, even making some sample food, that kind of thing, and do that with the whole family there if possible. What we know about this model, this came out of some work in Jacksonville about 5-6 years ago that was incredibly successful with high-risk pregnant moms who were food insecure, who gave 100% of those moms who gave birth had babies who were at normal weight, which was a huge win.
That is great.
So, yeah. So we're going to do this, we're working out the details of how we can launch a small pilot around that here for about 12 months and see what that looks like, and then hopefully be able to report back on some outcomes, both clinically and behaviorally, and be able to go from there. So that is something we're very interested in and really pretty much on the cusp of it. So your question's pretty timely. Do you work with the Healthy Start Coalition in Pinellas?
Yes, they're one of our partners, and
okay.
we're just working on a grant now that we hope to next year be able to service 380 young women in South St. Pete. So we're actually collecting data for a couple of different organizations because we really were looking for it a couple of years ago and there just wasn't any. So by finding out there wasn't any data really for this particular population, we've ended up being one of the data collectors.
Right. So that's interesting how you have to sort of skate with it a bit to make it happen and understand it. Is it possible that for those 380 moms that you would be able to include nutrition as part of the intervention?
We already have it as part of our grant. I'm a nutritional consultant and childbirth educator as well. So I do garden education with the young women and talk about
awesome.
They can use food that we grow. But it would be awesome to have it broader than just that. We have a couple parts of teaching them how to use a crock pot, things like that, since many don't have kitchens. So there's a lot of different aspects to it, but this is something that they need more quantity of food. It doesn't it's good to teach them how to cook something when they're only getting $20 to $40 a month in fresh produce.
Right. Well, you know where Karen lives now, so you can feel free to reach out to her directly if you want to continue.
Get in touch, and I'll be happy to share our progress with you.
Thank you so much, Karen. Is it Sarasota?
No, we're in Orlando.
In Orlando. Okay, great. So you know Jenny Joseph. She's one of our partners.
I don't know Jenny.
Oh, you need to know Jenny. Okay, I'll message you.
I'll keep that in mind. Sure.
Okay. I'm just curious, maybe as people thinking of questions, did anybody during the presentation have any aha moments like, hey, never thought about that, or that's an interesting connection or approach?
Well, this is Del Deshawn, convener of our session. Ken, I was Dave, I was particularly struck by your initial comments about being led to this work through social justice, and the immediate inspiration or drive to be engaged in this came through your background in social justice or from a social justice perspective. I would be very interested in hearing more about that, because I think that's often a part of the story of kind of the equities in our food system that is overlooked. The social justice aspect of it takes us right to the heart of, to my mind anyway, right to the heart of why more folks should be actively engaged in this work rather than seeing it as someone else's problem or something that can be mediated through existing corporate institutions. social
Right.
justice asks of us something else. So if you wanted to say a little bit about that, I know that there are listeners that would be interested in hearing more.
Yeah. Our vision, I shared our mission at the front of the presentation, but our vision literally as an organization is to inspire and engage the community to end hunger. We're not going to do it on our own. These millions of pounds of food donations, they're not ours. The millions of dollars that we have to raise to execute our mission, those are not really our dollars. The volunteer hours, we are just a conduit for the goodwill and the generosity of the community. With that kind of community support comes a lot of responsibility and a lot of humility to realize how big this is and how much bigger it is than us as an organization. This might be a stretch for some to connect the dots on, but with the social justice connection, and I guess we all maybe have kind of a unique perspective from where we're coming from. Before I got into this line of work, I was in the advertising agency business. So that might seem like quite an odd transition, right? From ad agency to, food banking and nonprofit. But what I have found is that with my background there, coming from an ad agency business, it's about communication and it's about telling the story and talking about the benefits to the people on the receiving end. And one of the things that I found in general, okay, I'm not going to paint everybody with a broad brush, but it's quite often that nonprofits in their work are not communicating well. They are so busy with the day-to-day of getting the work done, and you got to do the nuts and bolts, or making sure that payroll is covered, for the next week or month, that they can't rise above that to think about maybe how to promote themselves. It may sound a little mercenary, but if businesses have to spend millions of dollars to sell their products and services, I think it's doubly important that charitable nonprofits for social service causes must do it. So from a social justice issue, we're not hitting people over the head with that term, but we are constantly educating the community in a number of ways about who is hungry and why, and trying to break the stereotypes and the stigma that about half of our population have of who are the people in need. And often, unfortunately, it's broken down into the deserving and undeserving, which is really, really crude. But when that topic comes up from folks, I actually welcome it because it's a teachable moment, and maybe there's an opportunity to shed some light on it for them. So from a communications point of view, through our efforts here, it's advocacy, right? Pure and simple. We're advocating on behalf of these folks, many that do not have a voice. So we are very involved in government relations now as an organization and policy, starting from the national level down to state and local. I sit on a national policy council for Feeding America, and we have the close relationships with USDA and other bodies that are crafting policy. So I don't know if that answers your question or not. Social justice also comes from a deep-rooted faith perspective and faith practice. And it doesn't matter what faith practice you come from, but social justice and treating the poor and the hungry is a common web that is woven through all faiths. So thanks for asking that question, though. I appreciate that.
Yeah, we. I think Dave, we could have a wonderful discussion at length on the social justice dimension of this work. So often, and this is an area of my research, just as a point of note. So often it seems that, and I'm associate chair and faculty in the Department of Religious Studies at the University of South Florida. I work closely with Will Schombacher, who's one of the leading international scholars of food sovereignty. And we're interested in the connections from a traditional social justice perspective, the relationship between traditional social justice perspectives and the tremendous energies and thought and HR, human resources, and financial resources that actually go into our large-scale, food distribution activities. And we ask ourselves, and maybe it's a question for all of us to consider, is to think again, perhaps, of the intimate human dimension of these activities and these engagements. And I think so often, and I see, without question, so often that this, our feeding operations and our help for the less fortunate that are food insecure does overlook that human dimension, the face-to-face, the hand-to-hand, the intimate caring for others that, as you mentioned eloquently, is a part of every religious tradition that we have, every traditional religious tradition. And so often it seems that part of it, the human connection, the heart-to-heart, mind-to-mind, soul-to-soul connection, is overlooked in our really almost breathless efforts to try to get food to people that are in need. So that's a dimension that I am happy that you are aware of and that you bring to the table, so to speak. And that's one I don't want us to overlook.
I will definitely be following up with you, Dale. I would love to have a extended conversation on that.
And I feel we will. And thank you. And I see that we only have about 5 minutes left at this point. Dave, I thank you for your commitment, and I thank you for the powerful and dynamic presentation. This was a gift to all of us. And I'm going to just go out on a limb and just invite you back for another round of this down the road in the coming years sometime, because I think this is a topic of enormous importance for the Food Policy Council to be aware of, but also for us to share broadly with the Florida community that are interested in food systems and food studies and food policies. This is something that has to remain front and center in our consciousness and in our actions. So thank you for this, and I'm extending this invitation. I want to also invite Kendra to come back on the line with us for any wrap-up or final observations.
Again, just thank you so much for the wonderful presentation. We will be posting this presentation on our website this weekend, and the video will be accessible to everyone, anyone who is interested in this very important topic. And thank you again for being with us today.
It's our pleasure, really. Thank you. Everybody have a great holiday.
Yeah, and you as well. And let me underscore, too, what Kendra said for anyone that's on the line with us. Go to the website and get the link. Get the link to this presentation and share it with your friends and share it with anyone that is interested in this subject. We have now a library of these presentations, of which this, to my mind, is one of our very best. But we have a library of presentations on these topics, and they are rich learning experiences. You don't have to have participated even in this event to gain from it, and to be able to share it with folks that perhaps have not were not able to listen to this today or to watch the visual presentation as well. So please do share it, and please to everyone consider joining the Florida Food Policy Council. We are a 501c3 sanctioned not-for-profit organization, so donations and contributions are gratefully received, and also membership is encouraged. We are a membership organization that is working for the good and for working for greater understanding of food policy in the state of Florida, and we are an active organization as well. So come join us, be part of it, and be sure to join us next month for our presentation at that time. Thanks again for our outstanding presentation. Dave, our thoughts are with you for the good work that you're doing. And Kendra, thank you for your professional expertise and excellence in making sure that our systems work properly, and for your kind and gentle way. My best to everyone. Happy holidays, and have a wonderful new year. Bye now.
Bye-bye.